I'm Associate Professor Lee-anne Chapple. I'm a dietitian in ICU at the Royal Adelaide Hospital and also at the University of Adelaide I have a research fellowship. So my research in intensive care is looking mostly around improving recovery. We know now that patients tend to survive ICU, around 85 to 95% of patients survive, but we know that they have poor recovery. They lose a lot of muscle. They lose about 20% of their muscle in the first 10 days of being in ICU. And even patients that have had a really short stay tend to have poor recovery, even 5 years later. It's a bit unsure at the moment. We don't really understand why that muscle mass is so extreme. We see it in other populations, like when people go to space, they lose muscle. So some of it is the inactivity. These patients are most often in a coma, lying in bed. But we've done bed rest studies where we put patients in the same condition that aren't sick and they don't lose the same amount. In the general population, we know that if we're doing exercise and we eat protein, that can lead to muscle gain. We also know that in patients in ICU, we know their requirements are much higher as well because they lose so much muscle. So we think that giving extra protein will be able to support that muscle gain. So one of the complicating factors that I've found in my research is that the protein that we give to the patient isn't actually used to make muscle. So we did a study looking at ICU patients compared to healthy volunteers, and the patients could absorb the nutrition that we give, but then they didn't use that protein to build the muscle. So there's something that's causing that sort of blockage to actually get into the muscle. The aim of the study, the primary outcome that we're looking at is reducing time to discharge alive. So we think that these patients can get out of hospital quicker.